If you have been having elbow pain, then you are in the right place. Now, so stay tuned. I'll give you some information on how and why that happens and show you some things that you can start doing about it today. Elbow pain mainly comes from two conditions. The first one is called lateral epicondylitis, and you might say, "What in the world did I just say?" That simply means pain to the lateral side of the elbow, and it's what we also call tennis elbow. Now that you've probably heard about. Pain on the inside of the elbow is what we call medial epicondylitis, but it's also called golfer's elbow. Now, when I first see a patient in my office and they come with a prescription from their doctor that happens to say lateral epicondylitis or tennis elbow or golfer's elbow, usually the first thing they say to me is, "I don't even play tennis," or "I have never played golf before in my life." Which makes me chuckle a little, but then gives me the opportunity to explain to them that elbow pain is not coming from motion that's happening at the elbow. So it's not coming from what you're doing to your elbow on a daily basis, but it's coming from what you do at the wrist, hand, and fingers on a daily basis, which we all know is an awful lot of activity during a normal day. Now, this elbow pain can be on the outside of the elbow, like I said before, or the inside of the elbow. Usually, my patients will say it's very tender to touch on the bony part of the outside of the elbow and the inside of the elbow. Occasionally, they'll say that the pain even extends into the forearm a little bit, so more that upper forearm, but extends into the forearm on the back side of it or on the soft, fleshy side. The pain into the forearm is usually described as a dull, aching, or throbbing pain. That pain on the elbow or to touch is more of a pretty sensitive to sharp pain when it's bumped into something or you touch that. I have outlined a program for tennis elbow and then one for golfer's elbow. So if you're having pain on the outside of that elbow, then I want you to follow the tennis elbow exercise program number 1. And if you're having pain on the inside of that elbow and it may extend down into the fleshy side of the forearm, then I want you to view the videos in the golfer's elbow exercise program number 1. I have used these exercises with my patients for the past 25 years, so I know that they can work. I've seen firsthand how they can work. If you are having a lot of that elbow pain like I've described, then I also want you to use some ice on that elbow. That can be really helpful. Patients usually find that that's really helpful. You can do that 3 to 4 times a day for about 15 minutes each time you do it. And you want to put that ice directly on that joint if you can tolerate it. Now, if you have been having pain that's all the way up in the upper arm into the shoulder or the neck, and it extends all the way down that arm and even into the fingers, and maybe it's even accompanied by tingling or you're having some numbness, maybe it's feeling, that arm is feeling really weak and you find that you're even dropping objects. If that's the case, then that may be signaling that you have something else going on. It could be that you have a neck issue. And if that's the case, I want you to call your doctor. Go and see your doctor. Give him a chance or her to evaluate that and see if there possibly isn't something else going on. If you think your neck is not involved at all, it's truly this elbow pain that I've described, then I want you to view these exercise programs and see if we can't start decreasing some of your pain. I want you to commit to one of these programs for 2 to 4 weeks. If you get to the end of that time frame and you find that you're having less pain, you can do more things, then by all means keep going and go on to exercise program number 2. If you get to the end of that 4 weeks and you find that there is little to no change in your pain, then listen to your body and call your doctor. That's your body telling you that you need more intervention. You need more than what just an exercise program can do for you. So do yourself a favor and call your doctor if that's the case.